Hello, I'm Dr. Manisha Singh, Senior Consultant Gynecologist and Subspecialist at Fortis Hospital, Bannerghatta Road. My area of interest is infertility, gynecology, and assisted conception. Today, we are going to talk about IUI or intrauterine insemination. This is a very commonly used modality in the world of fertility treatment, and we are going to talk a little bit about it today. So, what is IUI? IUI literally means intrauterine insemination of your partner's or husband's sperm, which has been washed, prepped, and enhanced to enable you achieve a pregnancy. So, who are the patients that need an IUI or intrauterine insemination procedure? Should you have something called unexplained infertility, where all your baseline investigation parameters are normal for both the husband and the wife, but somehow the pregnancy has not happened? If you have mild male factor subfertility, where there are subtle problems with the sperm, if you have a problem with an ovulation or cycles where the egg formation and ovulation does not happen every month, if you've been diagnosed with mild endometriosis, these are all the conditions where intrauterine insemination will be used as a therapy before you jump on to in vitro fertilization or IVF. What is the basic workup that is needed prior to doing an IUI? So for a female, all the baseline hormone parameters will be performed, which includes your AMH, thyroid function test, FSH, LH, E2. In addition to that, you will need to undergo a complete viral serology screening. You must have had your tubal patency test or HSG done. This may be done via laparoscopy or hycosi as well. In addition to that, the male needs to have a similar workup done in terms of his viral serology, his semen analysis. And if all is well, the doctor will then take you through a cycle of follicle monitoring. The egg growth may be monitored through your own natural cycle, or the egg growth may be enhanced with the help of certain ovulation induction drugs like clomiphene, letrozole, or the doctor may resort to the use of gonadotropins, which are hormone injections in a small dose. With serial ultrasound scans, with blood test monitoring, on the day that your follicle is ready to release the egg or bring about an ovulation, the doctor will give you a trigger injection, and within 24 to 36 hours of the same, the insemination of the sperm is carried out. For the gentleman, the semen sample needs to be given on the day of the intrauterine insemination. The prep for the semen sample takes between 1.5 to 2 hours. When the semen sample is ready, which means that the good sperm has been separated out from the sluggish and poor quality sperm, the good sperm that has been enhanced and capacitated to bring about fertilization is then used in the lab procedure or theatre procedure, and this is performed under all aseptic precautions. The lady will then be taken to the room for IUI or to the operation theatre, and with or without ultrasound guidance, a fine tube or a catheter is inserted into the uterus and the sperm is deposited close to the opening of the fallopian tubes. So what is the success rate of this procedure? The success rate again varies depending on various baseline parameters and comorbidities that you might have, but it ranges anywhere between 15 to 20% per treatment cycle. The cumulative pregnancy rate is roughly around 35 to 40%, which means if 100 couples were to undergo this procedure, at the end of 3 cycles, between 35 to 40 of these couples would have achieved a pregnancy, and the remaining would then need to proceed with possibly IVF. What can you expect after an IUI procedure? You might feel slight abdominal cramps, or you may have a touch of spotting or bleeding. Post-procedure, we expect you to take it easy. You may be given medications in the luteal phase, like progesterone tablets to be taken orally, or injections, or in the form of vaginal pessaries. 2 weeks down the line, you will undergo a urine pregnancy test or a beta-HCG blood test to ascertain whether you are indeed pregnant. This is how a very simple procedure can be done, and it can give very fruitful results. Should you have any queries, you must always ask your clinician rather than referring to the internet for all the answers.